to them. And I might say that Greg and I have known each other for many, many years. He actually was a real estate broker at one time and worked for Cressa. So he contacted me, and we've had a great time working together, moving his business forward.
Well, thanks, Paula. Sent me an email probably 6 months or so ago, just saying, hey, this is what I'm going to be doing. And I remember like bells going off and lights going off, and said, Paula is exactly the person I need for this point in where we are in the Medicare world. But where I grew up, there was two kinds of people. I grew up outside of Philadelphia. There was members and there was caddies. And all my brothers caddied, all my buddies caddied, we all caddied. And the whole idea was, let's go have some fun and do it. So when I started living in this Medicare world, I said, you know what? There's very similar situations to what I did as a caddy. In fact, I even quit college after 2 years. I bought a van and was a caddy on the PGA Tour in 1979, 80, and 81. So I do know what it is to be a caddy, and you basically are an advocate. So that's where I carry the burden of knowledge instead of carrying a golf bag at this point in time. And after the Great Recession kind of sent me back, I was in the commercial real estate business for almost 30 years. I said, I need something to do. And I happen to have a brother who married my sister, who I'm very close with, and he's in Harrisburg, PA. He now has one of the largest Medicare insurance agencies in the country. And so I said, okay, I need to do something, because I'm buying a new car every semester with one kid at Emory, and I got another one going to Georgia, and all of a sudden the Great Recession went down too. So he said, you want to learn something about Medicare? So this is 2010. So I dove into it at the same time Obamacare was coming into being, and I started saying, you know what? This is pretty recession proof there. So I think I'm going to find out about it. So he said, why don't you open up an office in Atlanta, start training agents and recruiting people. So needless to say, I just dove in and started swimming as fast as I can, and found out that there's a great opportunity here in the Medicare world. So we called it Medicare Caddy, and basically go out and I work with, in the beginning it was all individuals, and now all of a sudden I do a lot of work with financial advisors. Their clients need to know something about Medicare. The financial advisors say, I'm not getting into that water, but I need somebody that I can trust to do it. So we do a lot of work with that. CPAs are starting to catch on. And then what I'm finding out now, a lot of employer groups. I'm getting requests to go down and talk to employer groups. And it's not so much the retirees, it's the currently working people that are Medicare eligible, but their idea is, I'll just stay on the corporate plan as long as I can because it works really well. And they're starting to find out that maybe they'd be better off getting onto Medicare. Medicare works very, very well. Medicare has a great opportunity, and anybody that's been 64, Drew and I talked about it, 64 and paying for your own insurance, and then you go to 65, you should definitely go out and celebrate or take a vacation, because Medicare is a huge step forward than what you're paying on your own right there. So, but the reason for being here, and I appreciate the opportunity, I'd never heard of ITB, never knew that this place existed, and I live walking distance from here. So I really appreciate this location, where it works well. But to introduce something called the Lasso Healthcare MSA. Make sure this is, maybe it's not working for me. I've got that plugged in right here.
Well, I can still advance it.
Okay. So people here know this whole movement towards consumerism is starting to take effect. And it started back from a healthcare standpoint, really back in the old days when people had pension plans, and they said, no, let's do this thing called an IRA or a 401k. I graduated from business school in 1981. And I remember there's these new things called mutual funds that people were saying, that sounds like an interesting idea. But that was the idea of getting away from the corporate and getting into people's hands. And then we went from defined benefits, where we're going to take care of your health care, to we're going to give you $500 towards taking care of your health care benefits. And then this big thing happened in 1997, where the government said, okay, we've got to find out other ways to handle this health care. So we're going to start paying insurance companies, and we're going to call it Medicare Advantage. And then also these things came out in 2003, health savings accounts, where the government started saying, you know what, we need people to start saving money for healthcare into the future. So we're going to make it tax advantage for them to start doing these high deductible HSA plans. So it's kind of been going by the decades. So now, believe it or not, we're 2 months away from 2020. Hard to believe. Very clearly, and it's not my idea, a lot of other people are saying that we've got to get consumerism into healthcare. This idea of having a healthcare provider, and then the insurance company, and then the patient, and then it goes back and forth like that. They've got to start putting it into the consumer's hands. It's the last industry that's really going to get pushed at it. So we're going from insurance plan directed healthcare to consumer directed healthcare. And in the world that I live in with the seniors, consumer directed Medicare benefits is going to be very, very nouveau starting very soon here. What about health savings account? It really is showing you where consumerism helps. It didn't start until 2003, and believe it or not, it was part of a Medicare Modernization Act. And what really triggered it is this Internal Revenue Code that said you can put money away tax-free and use it for, and there is a definition called qualified medical expenses. We call them QMEs. And then financial advisors, other people started saying, Fidelity just got into it last year, where they can say, we will start housing your HSA accounts there too. So it's really been taken off and growing. Just in the past 5 years, we went from about 12 million people having HSAs to over 25 million people having HSAs. That's just your number of people having money. But what the Fidelities and other people and financial advisors of the world like is the idea that it's going to grow funds to be invested. So you can see it kind of trickled along there for a little while until 2010. This is what's happened in the past 10 years. So the amount of money that's being put aside into HSAs is huge, but there's one negative, that when you enroll in any part of Medicare, you lose your HSA eligibility, so you can no longer contribute to it. So the government started saying, we've got to do something with that. So what are we going to do? The government's idea behind it all is we've got to make people more accountable, more responsible for what they're spending on healthcare. This idea of it only costs me $10 to go to the doctor, so anytime I need to go to the doctor, I'm going to pull a $10 bill out and go to the doctor. They say causes a whole lot more needs out there. So if you're more accountable and more responsible from the government's perspective, healthcare costs are going to go down lower over an extended period of time. And believe it or not, they need to be doing that. I tell people the earthquake has already happened. The tsunami is coming at our United States economy, and it's all about baby boomers living longer, more procedures, more prescription drugs, and who's going to pay for it. And no matter how, if you live long enough, most people are going to run out of money at some point in time. So how to manage it is what it's all about. And the Republican platform now is all about choice and competition in healthcare. You're going to see those words all the time going out there. The whole idea is let's give people choice, competition, and give them tax advantage money to spend, and it'll reduce costs in the long run. So that introduced what's called the Medicare Medical Savings Account, MSA. It's very similar to HSA. We're not going to go into a whole lot of detail about it, but it is very consumer directed. You get tax advantage money and it's put in your account, and if you need to spend it for healthcare, you go out and decide whether you need to spend it for healthcare. There's no network restrictions, which in Medicare is kind of the thing. Can I use this doctor? Can I go to Emory? Can I go to Northside? There's no restrictions at all. And this one, use any doctor, and all the hospitals in the United States take Medicare. So it really kind of takes care of that. And then you're also guaranteed to pay the lowest cost, which is the Medicare approved amount. That's another official term. So it's basically 20% of what most doctors would want to charge. If it's $100, Medicare approved amount is somewhere about $20. So you get the lowest cost, you can go wherever you want to go, and it has some advantages. In 2018, there was only 2 states that had Medicare medical savings accounts. It was New York and Wisconsin, and they were very concentrated on small groups. So this group called LASSO came out. In 2019, they introduced in 17 states. 2020 now, they're in 26 states and Washington, D.C. You can see where it goes there. 2020 is when it came to Georgia. So it's really ramped up here in Georgia in the last couple of months. Unique features real quickly. By law, if you have an MSA, they can't charge you a premium. I told you can go see any willing Medicare provider. The biggest challenge with seniors, and especially if you relocate, is finding a doctor that's taking new Medicare patients. They pretty much everybody will take you as an existing patient. You roll onto Medicare and they just change how they bill it. But to find new doctors that take new patients, it is a bit of a challenge in there too. But what happens with this one, instead of contributing tax-free dollars into an account, the government gives you $3,240 on January 2nd and says, okay, this is what you got to spend for your health care for next year. If you spend it all, then you start spending your own money. If you don't spend it all, you get to keep it, invest it, do what you want, and roll it into next year. So it's very, very different than anything that's been done before. But the idea is put money in the consumer's hands. They'll decide whether they need to spend it or not. And if you look at numbers, the numbers, averages can be different. The average Medicare person spends somewhere about $4,000. But if you throw in all the people, end of life issues, all the ALS issues, all the kidney disease issues, it gets, and end of life issues, it just gets so heavily weighted on that end of it that in reality, the typical person spends less than $1,000. So the idea is if you're a typical person, you get $3,200, you spend $1,000, you got $2,200 that's growing tax-free that you can also pull out and use tax-free. So that's the concept behind it. But there is a high deductible component to it also. In Georgia here, it's going to be $8,400. But of that $8,400, you've already gotten a chunk of it taken care of with the $3,240. So that's what they're doing. That's what they're pushing. It really makes a lot of sense for people that are on the healthy, health conscious. Let me look at healthcare as an investment as opposed to, I don't know what it costs me, but my insurance company tells me that I have to pay them every time I go, so I'll pay it. They're going to be moving away from that. Oh, one more. I keep pushing it, thinking it's moving forward. End of slide. So I call it Medicare Caddy. We call it longevity solutions. We help a lot more than just Medicare, but it all starts with Medicare. People have to figure out when they're eligible, when they enroll, how they enroll, what are my options, what about prescription drugs. Probably nobody's seen any of the advertising that's been going on here lately about Medicare, but if you didn't, you will, because this is the annual enrollment period, and I'll finish up with this one. Why they do so much advertising. The way Medicare Advantage plans work and prescription drug plans work is they try to sign people up in this 7-week period. For each person they sign up, they know they're going to get somewhere between $11,500 and $12,000 per person for next year. So the insurance companies get that money, they got to get that, and then they can parse it out and do whatever they can. So they spend all their marketing money here in the next 7 weeks to try to get people signed up between October 15th and December 7th, which will then start on January 1st of next year. But I live, eat, and sleep in the Medicare world. I do a lot and run around with a lot of people that are thinking about Medicare. Any questions that can be absolved? I've probably seen it before and happy to help out. It's very regulated. So if somebody said, hey, I need help with Medicare, call me. I'd have to say, I need to get permission to call you first, and I've got to get a written documentation with it also. So we've got some cards here that if anybody's interested, there's certainly no cost on the front end to say, hey, this is my situation. What do you think?
Does it replace supplemental insurance?
Yes, and supplemental kind of gets used out there. There's I call them Medigap plans. AARP basically is the brand for United Healthcare on their plans out there, but it is it's similar to that. It is an option. AARP and United Healthcare haven't gotten into the medical savings account business yet, but wouldn't be surprised if they start seeing the opportunity and say, we'll do it. But yes, it's all part of the big Medicare insurance world.
Is there a prescription drug benefit?
By law, Medicare MSAs cannot include prescription drugs, which is basically an advantage because then you get to go out. Next year, there's going to be 28 different prescription drug plans offered to Medicare people in Georgia. And the idea is you have to figure out, where do I want to shop? What are the prescription drugs that I have? And put it into the system that comes back out and says, okay, for your needs, this is where you can go and get it the cheapest. And you need to know about that because they do have preferred networks, they have standard networks, and then they have out of networks. So you could go into one shopping center and go into Publix and that drug would be $10. You go into CVS, it's $2, and you go into Walgreens, it's $300. So it's all depends on where you go and what plan you have. So the idea is, and especially prescription drugs, that's the Wild West, if there ever was the Wild West going on right now. Well, that's just it. And I'll use Lasso Healthcare, which is the one providing this MSA. They sign people up. They have a contract with the government that says for every person they sign up, they're going to get $11,000 next year. And then it becomes a shell game. What do you do with that $11,000? We can move it around. We can give you hearing aid benefits. We can give you healthcare benefit or dental plans. We can give you zero premium, which is basically one of the benefits right now. How they spend that $11,000 all depends. They can give you gym memberships. They can play with it. So one of the ones, the MSA comes out and says, okay, we know we're going to get $11,000. We're going to give you $3,240, and you go out and spend it until you get to that deductible amount, and then we'll take care of everything beyond the deductible. So I get that question a lot, like, how can I get insurance and it doesn't cost me anything? It's because the federal government is paying the insurance company to take care of it. Somewhere back in the 50s, the American Medical Association and insurance companies got together and said, guess what? If we lock arms in this thing, we can both make a whole lot of money if we can control the situation. And they're trying to break that mold right now. And needless to say, AMA and insurance companies have a lot of sway in the world. It's not going to happen overnight, but the idea is to push it to the consumer. Thanks for your time. I appreciate being here. Paula, thank you very much.